IU. First guest of the morning joins us right now. He represents House District 14. That is Union County, the great state of New Albany. Sam Creekmore. He is chairman of Public Health and Human Services. Sam, good morning. Really appreciate some of your time. Always good to see you.
Likewise, Richard. Thanks for having me.
What's going on in your world right now? We are in that time of the year that I call the off season. I know that in truth there is never really an off season for legislators, especially those with chairmanships. So this time between sessions, what has been occupying your time?
Well, I just want to start off, Richard, because every time I'm on your show, we talk about sports. So this is pretty new territory now. But in my world, and you'll appreciate this, Cotton States ended this past weekend. We finished our 17th collegiate season. So that my world is starting to settle down, hopefully.
All right. So let's pause just for a second, because even though it's been going on for nearly 2 decades, there are people that still don't know about the Cotton States Baseball League. You and some others in the New Albany community came together to put together a summer league and now a fall league as well, part of which is wood bat, and you got players coming in from all over the Southeast to play in Mississippi.
All over the country. We had a kid from Oregon this year. Yes, sir. So he had a good summer. His team won the league. So, but it's started out as a summer collegiate baseball league, all played in New Albany. And so we have kids from all over, mostly from the Southeast. You're right, but really we have kids from all over come into New Albany, and they play college baseball here in New Albany. And it's really unique.
I coached in that league. I coached up there.
He sure did.
Won it all, baby. Tupelo Thunder.
That's right. And so we've expanded this to high school and junior high as well. And a lot of the college players will end up coaching our high school and junior high during the month of July. But the collegiate league lasts June and July. So it ended this past weekend. And so I've got my weekends back at least for a little while.
There you go. That'll be good. This Opioid Advisory Committee, we know that there's a big settlement that has come to the state of Mississippi, and now, if I understand it right, it's the committee's job to make arrangements for how that money is going to be distributed, where it's going to go, the different things that it is going to support. Forgive me for starting here, because I know many of you that are on the committee would love to leave this in the rearview mirror, but the Opioid Advisory Committee meeting a week or two ago was disrupted and knocked offline pretty quickly thanks to what some have described as a cyber attack.
Yeah, and let me just give you the background. The state of Mississippi joined a lawsuit or started a lawsuit in 2021, the Attorney General, against the opioid pharmaceuticals. And we've won that. Money started flowing into the state. And Senator Boyd on the Senate side and me on the House side both authored a bill to create this council. And it's made up of people from all over the state, from many walks of life, from many disciplines, who had history and expertise in this space. And so we've got this bill passed, and both Senator Boyd and I, part of our mission was to get the money out as quick as possible, because these people who are suffering from addiction and opioids need help as quick as possible. So, we're kind of on a fast track with this council. And so we met once, we established kind of our guidelines, and then in our second meeting, which we were going to approve and codify these guidelines after, and you know how these meetings go, you do your roll call, you establish a quorum, and then this was all by Zoom. And keep in mind, Richard, you got mothers, grandmothers, you got Supreme Court justices, all on this Zoom. And you got people who've been through addiction issues. And so, we get through the roll call, quorum's established, and, the first document is up on the screen for everybody to review. And then the screen goes blank. And then this pornographic scene appears on the screen, and it lasted maybe 15, 20 seconds. And then the meeting was over after that. And, maybe you can joke about it, but at the end of the day, this is a serious issue, and it's delayed us a week from getting these things accomplished. We're going to meet Friday at 1:00, But whoever did this, it's not funny. It's a serious issue. And I did talk to the Attorney General's office yesterday to see where they were. They're actively investigating this cybercrime and this hacking of this meeting. So that's what happened, and it's a shame.
I should probably, Sam, raise my hand and admit that I made a little more light of it. I understand the seriousness of the overall topic, and obviously there's a lot of work to do, and we're going to talk about this, but.
Yeah,
there was, I thought, at least a level of humor in there, but
and
probably
there
misplaced humor. Yeah,
there is, and it's just like our meeting now. If somebody was to hijack our Zoom right now, it would not be cool for me and you.
No, it wouldn't. I mean, there might be a day where I laughed at it, but I'm not sure that today would be that day. All right, so the amount of money and the avenues through which it's going to be spent or which it's going to be distributed. Kind of give me at least a working plan on that.
Sure. Well, I in total, the state of Mississippi is going to receive around $370 million. Now, that's not all coming at one time. I think we've received around 84 million or so right now. And 70% of that goes to this opioid abatement, which this council will recommend where that money goes. That's 70%. 15% is going to cities and counties who are part of the lawsuit, and they'll have control of that. And then another 15% goes to the legislature, which it doesn't have to go to opioid abatement, but that's my plan, is that 15% that the legislature controls will still go to opioid abatement programs. So the 70% is what this council doesn't control, but we recommend where that money is to be spent. And then we make our recommendations, the council, and that goes to the legislature, and the legislature says yes or no to each recommendation. The money will come. Go ahead.
We get this question here, and I think this is a good one. Is the settlement going to be used to help with treatment for those who are affected by opioids? Is it for rapid response, making Narcan more readily available? I saw a story, I think it was earlier this week, maybe it was last week, and you're reminded of how prevalent and how serious opioid issues can be. There was a police officer who was making a routine arrest, came into contact with someone who had, I guess it was methamphetamine on them, had a reaction to that, and it was because one of her colleagues had access to Narcan that they were able to get her taken care of and stabilized. So in terms of the balance of how the money goes, and I know you say a lot of different avenues, is it all of the above?
All of the above, yes. The 70% has to be toward abatement issues, which, yes, that would be treatment, that would be toward education. But yeah, our goal was to get it in the hands as quick as possible. So there are nonprofits out there that are taking care of people suffering from substance abuse and addiction, and so they would qualify, and so they would apply for this grant, for this money. There's a rubrics system where it's graded, and then they'll, wherever they fall in that tier, will be able to receive money. And the state of Mississippi is going to be getting money over the next 12, 14 years from this lawsuit. So it can reoccur again and again over the next several years.
Visiting with Sam Creekmore, he represents District 14 in Union County. We have seen the border crossings, illegal border crossings, stem significantly in the last 7 months now in this new administration. Are we seeing an effect in the amount of illicit drugs that are coming into the country that you think is that we can see yet? And we only have about 30 seconds to the break. We'll talk more about it after this.
Yeah, I've not seen a slowdown. We had a slight slowdown in the opioid use this past year, but not significant.
Take a quick time out. We got more coming up with Sam Creekmore, including a pretty strong opinion that he's got about veterans in Mississippi, veterans in the United States, and what we need to be doing for them on the mental health front. All of that coming up with you. It's Mornings with Richard Cross on SuperTalk Mississippi. We're back right after this. Good to be with you this morning. It's Mornings with Richard Cross. We are wrapping up the 7 o'clock hour with Sam Creekmore. He represents District 14 in the Mississippi House of Representatives. and is chair of the Public Health and Human Services Committee. Pretty significant date, Sam, on the calendar that's coming up. August 28th, a hearing that's happening at the legislature, joint House and Senate hearing to explore the clinical potential of Ibogaine. I think I pronounced that correctly.
Ibogaine.
Ibogaine?
Ibogaine.
Okay. Well, Google lied to me then. So this is currently a Schedule 1 substance
It
in
is.
the United States. And there are studies that say that this helps significantly in dealing with PTSD and in some cases opioid addiction, opioids, which are among a cocktail of drugs that are sometimes prescribed for those returning, especially servicemen and women who are dealing with the after effects of combat or being away from the United States. Walk us down this road, if you don't mind.
All right. Ibogaine is a natural compound that is extracted from the iboga plant, and it's been around for centuries. And in the 60s, when Nixon was dealing with all the psychedelics issues in the United States, he swept Ibogaine and several others up into this and made it a Schedule 1. And so to be Schedule 1, you have to have an addictive characteristic and have no medicinal value. Those two, and Ibogaine does not qualify for either one. It's not something you use to get high. It's not recreational, but it does have significant impact and effect on, as you mentioned, the PTSD and addiction, whether it's nicotine addiction, cocaine addiction, or in our case, that we're talking about opioid addiction. And after a 24, 48-hour period of going through this Ibogaine process, which has to be done in a clinical setting, you don't go and just take it home. You're in a hospital or a clinic, and you're monitored by doctors and nurses during this period. After that process, you come out, and 80% of the time, your withdrawal symptoms are gone, eliminated. There's nothing else out there like that right now. Your PTSD.
Is that for a short time period or in perpetuity they're gone?
Well, if you go through 2 doses of it, it's up to 90% forever gone. So I mean, there's nothing out there like that. So and that's it. So I mean, we've got methadone and other drugs out there, but you take those throughout the process, and you never really recover fully. Some do. But this is, in many cases, a one-time fix, and it's not pleasant to go through. But in the United States, it's illegal. In Mexico, it's not. Brazil, it's not. So we have veterans by the thousands going to Mexico and other places to be treated, to be made whole. And we have an opportunity, and that's what this hearing is about. And we're going to have veterans who've gone through the Ibogaine process, who've come out the other side a whole human being and be able to live a productive life.
I'm wildly fascinated by the possibilities that are here. One of the first questions that pops into my mind is, when you think about opioid addiction, one of the things that we've heard is that there are people who were able to get off opioids through the use of kratom. And we know that has been a hot topic here in Mississippi. And the arguments for it have been, well, the kratom plant in its purest form, but we ended up with synthetic kratom and stuff that's bad and unregulated and all of these things. When you start talking to me about a plant-based substance that helps specifically, I can't help but wonder about side effects or addiction possibilities to this going forward. How are these things different? Ibogaine, the iboga plant, and kratom, and kind of the naturally occurring kratom plant?
Right. Well, and that's a good question. I'm glad you asked it. But this process is not pleasant to go through. You're in you're throwing up. You're having dreams. I mean, it's just very difficult to go through it. So this is not something that's addictive or that you're going to take recreationally. It's just not going to happen, nor is it available to do. I mean, it's very tough to get Ibogaine. So unlike the kratom or marijuana, It's not something that's going to give you a high. It's
not going to be in a
medicinal.
can and a drink at the
It's
local
not.
convenience store. Okay.
No. And we do regulate kratom, by the
sense-
way, now.
Right. Yeah. Thankfully.
Yeah.
Do you? We got 30 seconds to the break. Do you sense support from your colleagues for
Very much so.
pushing
Yes.
Mississippi forward in this?
Yes, it's a Senate House hearing, joint hearing, and very much support. And with the people that are going to be testifying and their stories, it's very incredible.
You can read an op-ed that Sam Creekmore has written about Ibogaine. It'll be available on our website, supertalk.fm, and a lot of other places that it's been sent for your consumption as well to learn more about this. Sam, always appreciate the time. Thanks so much for being with me.
Likewise, Richard. Thank you.
Sam Creekmore, chairman of the Public Health and Human Services Committee. 8 o'clock hour on the way. Kelly Bennett joins us next.